Hello, dear viewer. Good afternoon to you. Alright, so in this video, we will be learning about benzocaine, a wonderful drug. Okay, let's begin. So, what is benzocaine? Well, it is a local anesthetic that is used topically or by dentists when treating patients in the mouth or teeth. And what is a local anesthetic? Local means a particular region. Anesthetic is just any drug that is taken to relieve patients of pain. So it just basically numbs the area affected. What is this drug about, chemically speaking? Well, the structure of benzocaine contains a benzene ring, and in the para position, we have an amino group and an ester group opposite each other, so that the IUPAC name is ethyl for benzocaine. It was first synthesized in 1890 by a German chemist, brilliant man. His name was um, Edward Wheatzert, and the drug was not ready for sale until 12 years later in 1902. So yeah, the dosage form of this drug is usually comes as an ointment. It is prepared together with other ingredients and then applied locally on the skin topically. So what is the pharmacodynamic of this drug? How does it work? How does it cause the numbness of pain, like you do not feel pain? So how it works is when you apply the benzocaine topically on your skin, it hits or comes in contact with receptors, binds to the receptors, and then blocks the voltage gated sodium channels. What am I talking about? Well, what are sodium channels? The thing is, for the receptor to send a message to the brain telling it that it feels pain, it has to undergo something called depolarization. So once it receives um, the stimulus, the stimulus is going to be pain. When you feel pain, it causes the receptor to depolarize. Now, depolarization of the cell would cause impulses to be traveled from the receptor to the brain. Without depolarization of the cell, there would be no action potential. If the action potential is not reached, and then there will be no message sent to the brain. So what benzocaine does is it blocks the voltage gated sodium channels. What do I mean by that? The thing is, once you actually feel pain, the receptors, what is happening is the receptors have to do something called depolarization, meaning there will be sodium influx and then potassium efflux. So sodium rushes into the cell netly, like it's not like sodium is not inside, but there is altogether there will be net influx of sodium and then net efflux of potassium. That's what causes depolarization. But if there is no influx of sodium, there will be no efflux of potassium, and so there will be no transmission of pain impulses to the brain. And so, yeah, when benzocaine binds to the receptor, the the voltage gated sodium channels get blocked so that there will be no influx of sodium and hence no message sent to your brain. When I say um, voltage gated sodium channels, the thing is when the stimulus stimulates the receptors, the the um, the electric potential around the cell membrane of the receptor changes, meaning like how would I put this? There will be increase in electric potential of the receptor. Increase in electric potential of the receptor would cause these channels. Increase in electric potential of the receptor will cause these channels to open and then sodium goes in. But if these channels are blocked, even when there is increase in voltage, it means there will be no sodium influx and there will be no message sent to the brain. And so that's it. Why why is sodium not and why is benzocaine not really taken in orally? Why don't you take in benzocaine? Why is it not a systemic or general anesthetic? Well, the thing is, one thing about benzocaine is it's a very strong oxidizing agent. And so if you know about the hemoglobin, hemoglobin is the compound or complex that carries oxygen from your lungs to all the tissues in the body. And the iron found there is it's iron 2. So it's ferrous, it's called ferrous iron. But what what benzocaine does is if it comes in contact with the red blood cell, which eventually would come in contact with hemoglobin, it would oxidize your ferrous to ferric, and ferric does not bind to oxygen, meaning there would be decrease in oxygen in the body. And if that happens, if the ferrous gets oxidated to ferric ion, then the surrounding ferrous ions that do have oxygen bounded to would would stay so tight with the oxygen that once the hemoglobin gets to the actual tissue it needs to supply oxygen to, it will not release the oxygen. So that's bad for your body. Hence, the name of the um, disease, or that call it disease now, it's called um, methemoglobinemia. So the compound that is formed is called methemoglobin, and the phenomenon is called oh god, it's a mouthful. Methemoglobinemia. So that's it. It happens when you take benzocaine in very high concentration. Alright, so how can you synthesize benzocaine? Well, you could do it in, I think, in two ways. You could do the Fischer esterification of benzoic acid and ethanol to get benzocaine under the top. Or you could um, reduce ethyl para. What's that word? Ethyl para. You could reduce ethyl para aminobenzocaine. No, ethyl para aminobenzoate. Okay. Benzocaine could be gotten in two major ways. Either esterification of esterification reaction, that is reaction between benzoic acid and ethanol to give benzocaine and water, or the reduction of ethyl para aminobenzoic acid to give you benzocaine. So what else do you want to say about this drug? Well, I think that's all I can remember for now. So let's recap. What is benzocaine? It is a local anesthetic that is given only topically or used by dentists orally in the mouth. You do not take it into the body because it's a strong oxidizing agent and so could cause methemoglobinemia. That's a long word. But anyway, methemoglobinemia is a disease or phenomenon where the amount of oxygen in your blood is drastically reduced, which is bad for you. So that's it. That could lead to a lot of other diseases, things like anemia. It is actually called a functional anemia. Um, we've learned that the way benzocaine works is by blocking the voltage gated sodium channels of your receptors so that there would be no impulse transmitted from the receptor to your brain telling it that there is a pain stimulant on your body. Alright, there we go. This is my actual first video on YouTube, so um, if the video was difficult to watch, my apologies. And I think I'll catch you later. In my next video, I'll try to talk about another drug, which we, which I do not know. So, anyways, catch you later. I hope you've learned one or two, even if I was just going all around in that video there. Bye. Later then. Catch you later.